As a cardiac surgeon who has spent years studying aging hearts and reviewing long-term patient outcomes, I want older adults to understand one critical truth that medical science now clearly supports. The way your body responds to certain commonly used drugs changes significantly after the age of 60, and this shift can quietly place stress on the heart if not carefully monitored. Research from institutions like Harvard Medical School and Johns Hopkins University has shown that age-related changes in liver metabolism and kidney filtration slow the clearance of many medications, allowing them to remain active in the bloodstream longer than intended. This prolonged exposure can increase risks such as elevated blood pressure, irregular heart rhythms, fluid retention, and weakened cardiac muscle function, especially in seniors who take multiple prescriptions daily. Studies published through the National Institutes of Health in the United States confirm that polypharmacy, the use of several medications at once, is one of the most underestimated contributors to cardiac complications in older adults. Drugs that are often considered harmless, including certain pain relievers, sleep aids, and long-term anti-inflammatory medications, have been linked to increased cardiovascular strain when used continuously without reassessment. The Mayo Clinic has repeatedly emphasized that what protects health in middle age can become harmful in later decades if dosage and necessity are not reviewed. This is not about blaming medicine, but about using it wisely, in partnership with lifestyle and preventive care. One of the most powerful protective steps for heart health is nutrition, a fact strongly supported by decades of research from universities such as Stanford, Harvard, and the University of Oxford. Diets rich in whole, plant-based foods have been shown to reduce inflammation, improve blood vessel flexibility, and lower the risk of heart disease. Leafy greens provide nitrates that help blood vessels relax, a benefit confirmed by studies from King's College London. Oats and legumes help regulate cholesterol levels, supported by findings from the American Heart Association. Healthy fats from olive oil and nuts, staples of the Mediterranean diet studied extensively at Harvard School of Public Health, are associated with lower rates of heart attacks and improved longevity in older adults. Physical activity remains another cornerstone of heart protection, even more so in later life. Research from the Cleveland Clinic and the University of California system shows that moderate, consistent movement strengthens the heart without overloading it. Walking just 20 to 30 minutes a day improves circulation, lowers resting heart rate, and enhances insulin sensitivity. Light resistance training, approved by geriatric exercise guidelines from the National Institute on Aging in the United States, helps preserve muscle mass, which directly supports cardiovascular efficiency. The heart does not need intense workouts in older age. It needs regular movement that signals resilience and balance to the nervous system. Sleep quality is another often overlooked factor that significantly influences heart health. Studies from the University of Chicago and the UK's National Health Service demonstrate that poor sleep disrupts blood pressure regulation and increases stress hormones that strain the heart. Seniors who maintain consistent sleep routines show better heart rate variability, a marker of cardiac health recognized by Johns Hopkins Medicine. Creating a calm nighttime routine, limiting caffeine later in the day, and ensuring adequate exposure to natural light in the morning can naturally improve sleep cycles without additional medications. Stress management is equally critical. Chronic emotional stress has been shown to elevate cortisol and adrenaline, hormones that increase heart workload over time. Research from Stanford University and the University of Cambridge confirms that relaxation techniques such as deep breathing, mindfulness, and prayer can lower blood pressure and improve vascular function. Even short daily periods of quiet reflection activate the parasympathetic nervous system, allowing the heart to recover. Social connection also plays a vital role. Long-term studies from Harvard University's Human Development Project reveal that strong relationships are one of the most reliable predictors of heart health and longevity, even more influential than cholesterol levels in some populations. Mindset, though often dismissed, has measurable physiological effects on the heart. Research from Yale University and the University of Pennsylvania shows that optimism and a sense of purpose are associated with reduced inflammation and better cardiovascular outcomes in older adults. When seniors believe improvement is possible, they are more likely to engage in healthy behaviors, adhere to medical advice, and recover faster from illness. The brain and heart are deeply connected through the autonomic nervous system, a connection well documented in neuroscience research from UCLA. Medication awareness remains central to this discussion. Medical guidelines from the American Geriatric Society recommend regular medication reviews for all adults over 60, a practice also supported by the UK's National Institute for Health and Care Excellence. This ensures that every drug taken still serves a clear benefit and does not silently undermine heart health. Seniors should feel empowered to ask their doctors whether dosages are age-appropriate, whether interactions exist, and whether non-drug alternatives could safely replace or reduce long-term use. The heart is remarkably adaptable, even in later decades of life. Evidence from the Framingham Heart Study, one of the longest-running cardiovascular studies in the United States, shows that lifestyle changes made after 60 still significantly reduce the risk of heart disease and improve quality of life. Aging does not mean inevitable decline. With informed choices, gentle movement, nourishing food, restorative sleep, emotional balance, and thoughtful medical care, the heart can remain strong, energetic, and resilient well into the later years. And the most important message every senior should remember is that healing and improvement are always possible when knowledge, consistency, and hope come together in daily life without fear and without rushing the process. Because true heart health is built gradually through small decisions that honor the body's changing needs and respect the wisdom gained through years of living and learning and caring for oneself with patience and trust in science, and proven medical guidance from institutions that have dedicated generations of research to understanding how the aging heart can continue to thrive and support a full and meaningful life, even as time moves forward and the journey continues with awareness and calm confidence.